Hi, I'm Sarah from Woodborough House, and I'm just going to tell you a few things about when you have a crown, or some patients call them a cap, placed and you're wearing a temporary crown in between appointments from your preparation to your final fit. Now, when you've had a tooth prepared for any dental treatment, but especially a crown, the tooth can get quite sensitive to hot and cold things. That's completely normal. When we put the temporary crown on, we don't cement it with a permanent cement, so we just use a very light temporary cement. So you will notice hot and cold things will permeate through to your tooth and you may just get a little bit of sensitivity. That's normal. Take some painkillers if you want and try and avoid those really hot or cold waters or foods, especially when you're brushing your teeth. Just use a more tepid temperature on your tooth cleaning regime. It is possible whenever you have any dental treatment done that the nerve will become very sensitive and inflamed, hence the reaction to hot and cold. If it becomes very achy constantly and it's waking you up in your sleep, then that is a sign it may not resolve and you may need further treatment, which is root canal. So if you're not sleeping and you've got constant toothache, painkillers aren't touching it, then please give us a call. Avoid chewing on very chewy or hard things when you've got a temporary crown. Because they're temporarily cemented, they can easily be lifted off and they're very thin, so they can also break. So try and avoid anything hard or chewy, just be sensible with what you're eating. If your crown does come off or it does break, it's really important that you have it replaced very quickly because teeth move into the space we've created. So if you can ring the practice, the girls on reception will advise you what to do. If it comes out and you're away somewhere or you can't get a hold of the practice, then please try and put the crown back in with a temporary cement you can buy from the pharmacy, or you can actually use denture adhesive, which is like a sticky gummy material. So if you're really stuck, grab some of that from a pharmacy and try and relocate the crown back into place. One of the things to be very careful of is when you're flossing. Your dentist will advise you as to whether or not you can floss, but if you are going to floss down or up into the contact point and pull the floss out. If you come back into your mouth through the contact point, you're very likely to dislodge the crown, and that will obviously mean you have to come back and see us again. It's really important if you've got one or multiple temporary crowns in your mouth that you are very mindful of what you're eating colour-wise. A lot of foods have food colouring and the plastic of the temporary crowns can absorb this and take on the colour. Things like curries, particularly with turmeric and cumin, be very careful of because it can make those temporary crowns go bright yellow.